then Apollo can do it. And do we have the self-reliance in terms of?
We have the joint registry data with us. So we are doing on an average every month 14 to 20 joint replacement at this center. So all over Apollo, like Apollo Chembur is there, Apollo Belapur is there. So those people have different data with them.
So India is equipped to handle such cases, like joint replacement.
Obviously, now we are doing much better replacement. That's why the people, they come from outside, especially from the Middle East, and from Africa and other part of the world also, they come to us.
Hip implants, are they affordable, accessible?
There are different varieties of implant are there, but for her, what we have used is the best implant, that is Johnson & Johnson. So that is the best hip implant till now. And there are other companies also which are manufacturing. But for a young patient, as per our experience, this is the best implant.
Sir, is it like, what is the cost factor? Like, is it affordable?
Yeah, obviously,
because here in India it comes under the scheduled category.
Yeah, it is there under the scheduled category. It is there. It is affordable only.
What would be the cost?
So it depends on different implants, like what type of implant. Like sometimes it depends on the surgery. If I use the cup, I use maybe some extra plates, maybe I use bench. So those all implant cost, it goes up, and it can come down also. Every patient has different choice of implant, and the plan of the surgery is also different. Apollo Spectra Hospital at Tardep, and it is a privilege to perform such surgery on such a young patient at this center, as this center is having all the best equipments which is required for the surgeon to perform and deliver excellent results. This patient came to us from Kenya, and she was operated at the age of 12 years over there after the surgery. And over there they did a surgery with the screw placement in both the hips. And after the surgery, she wasn't able to walk and she was having pain, and there was a limb discrepancy of around 1 centimeter. And because of this, she wasn't able to continue to do her school and do daily activities. After which she tried to go to several centers at her hometown, but she wasn't able to get the treatment which was required over there. So somehow she came to us. ऑपरेशन डिफिकल्ट इसलिए था कि ये पेशेंट बहुत यंग है. यंग पेशेंट में हम लोग हिप रिप्लेसमेंट या नी रिप्लेसमेंट जल्दी नहीं करते. वो इसलिए नहीं करते कि 15-20 साल तक हमारा जो इम्प्लांट सर्वाइवरशिप रहता है वो बोन के साथ चिपका रहता है. वो फिर बोन गिव अप करने लगती है. जैसे सामने पूछा था कि क्या ऑस्टियोपोरोसिस का ट्रीटमेंट क्या है. फीमेल्स में अर्ली ऑस्टियोपोरोसिस बहुत जल्दी हो जाते हैं, तो वो एक रीज़न रहता है जिससे इम्प्लांट गिव अप हो जाता है. तो उसके लिए हमको रिवीजन करना पड़ता है. तो ये एज में हमने पेशेंट को भी समझाया है, इनको बताया भी है कि आपको अपनी डाइट लेना है, अपना वेट कम करना है, अपनी एक्टिविटीज़ क्या क्या करनी, वो सारे प्रोटोकॉल्स हम इनको पेशेंट को बताते हैं, सर्जरी से पहले भी, सर्जरी के बाद भी.
आपके यहाँ पे सुविधा क्या क्या उपलब्ध है ऑपरेशन के लिए?
यहाँ पे तो सारी सुविधाएं उपलब्ध हैं जो एक प्राइमरी सर्जरी के लिए. ऑलमोस्ट एवरी सब इक्विपमेंट यहाँ पे है ऑपरेशन थिएटर में. हमारे पास 4 ऑपरेशन थिएटर है और चारों ऑपरेशन थिएटर इट्स वेरी इक्विप्ड.
And what are the other facilities in this hospital, and can you elaborate something about the hospital?
That I think Ashfaq will be better person to answer that.
To answer your question, sir, thank you very much, because you should understand what kind of facility you are sitting into. So this is around 15,000 square feet hospital. It's a very small sort of setup, but very complex and well-to-do setup. As rightly sir has shown in the PPT also, that we have robotic available over here. We have around 24 beds, 4 modular OTs, 4 bedded ICU, So whatever is required for doing any kind of planned surgeries, we are very well equipped with those equipments. In fact, we have latest equipment for all kind of surgeries like you must have always heard about laparoscopic surgeries, the keyhole surgeries. We can do that over here. We can do urology, high-end procedures also, end-to-end procedures in urology, general surgery, ENT, spine, orthopedics. So all these surgeries are more of the time are planned cases. So we are aware of what kind of requirements are going to come, and we are very well equipped with all those things in this smaller setup. So normally investigation wise also we have X-ray, sonography, whatever basic investigations, we have our lab over here. So all blood tests are done in-house. So whatever is required for secondary care is available under one roof. So you don't need to have a big hospital, big picture kind of a thing. Everything can be very well managed in this setup, sir.
Thank you.
Thank you. As rightly said by Dr. Nadvi and Dr. Monica, there was a perception in everyone's mind that wherever there is a complicated cases, it has to go to a bigger hospital setup, tertiary care setup where under one roof you will find everything, right? So whenever there is any kind of emergencies happening in our family also, we rush to a bigger hospital, not to a smaller setup. By seeing this 15,000 square feet setup, nobody would can imagine in past that this kind of complex surgeries would be happening in this kind of a setup, right? So day by day, the innovation is coming into the market. We are understanding the disease very well. So it's not the size of the hospital, it is purely depending on the specialization and the kind of care a hospital gives to the patient. So that is very important for everyone to understand. Now the healthcare has to reach every corner. It is not easy for each and everyone to reach to the bigger tertiary care hospitals to find affordable healthcare with the best of the equipments available in the market. So that is how we differentiate ourselves as Apollo Spectra hospitals. You won't be finding so many hospitals with a similar brand name available in entire India. We cover around we have 22 centers with 16 cities which cover, and this is primarily secondary care setup where we planned our cases very well, so the outcomes are far best. We have been applauded with most of the good awards in last year's. One of the awards we recently got was Gold Award for Best Healthcare Delivery Brand at the 9th India Health and Wellness Summit. Whereas
joint surgeries carry a higher risk than the general procedures that we perform because they put the patient through the heart through a stress. There is the chances of embolism are higher because of any bone fragmentation, and if the joint catches infection, then there is septicemia. So additional to all of these complications, in Mariam's case, she was obese and was going to be operated on a joint which was previously already operated. So these two were a very high challenging pointers for us. So my skilled team, we devised and personalized, customized plan, anesthesia plan for her. Considering her age, considering that she was not from an Indian origin, because there are certain bodily geographical conditions which are different. And with the skilled surgeon that we had on our team, the state-of-art technology that is available to us at this center, we carried on the anesthesia under spinal anesthesia very smoothly. After the procedure was done, she was followed up post-operatively also and made sure that she was comfortable. So happy patient makes the surgeon happy, and that makes the anesthetist happy.
Just closed, and the bone quality was challenging for us, and the most important part and the difficult part was to remove the implant. The implant placement was not in proper position, so it was very difficult to remove the implant. And it was around 5 years old surgery, so the bony growth was there around the implant, and it was a challenging task for us. And also, for another challenge for this was to achieve the length, which the patient had the shortening of 1 centimeter, and also to restore the hip and to balance the hip and have a proper rehabilitation program after the surgery. So, and actually, what is